I just had a female patient who came in to see me with a list, I'm not joking, a list full of symptoms. She's 44 years old. She has gone to her doctor to check her hormones, and he will not check her hormones because she is still getting a period, a regular period. And he said, you cannot be perimenopausal if you are still getting a period. Wrong, false information. If you are still getting a period regularly and you're 44 and you have all the symptoms of perimenopause, you can still be in perimenopause. So first of all, I want to say that perimenopause symptoms can start at the age of 35. For a lot of women, they start at 35 and they can happen, all throughout their 40s into their early 50s when they hit menopause. And in that 10 or 20 year period, little symptoms start to show up. Your mood changes, you're more tired, your energy is less, your libido is less, your sleep is interrupted, your joints hurt, your skin is dry, your memory is gone, you have brain fog, you can't recall words, you have all of these symptoms that are starting, but they're progressively getting worse as time progresses. And that can absolutely be perimenopause. Now, what I also hear a lot of is women come to see me and they say, I'm here to see you because my doctor won't check my hormones. My doctor said there's no point in checking my hormones in perimenopause. That is actually true. Your hormones are fluctuating like a roller coaster. Your hormones are up and down and all around during perimenopause. That a blood test actually doesn't change our course of treatment. So we use blood tests sometimes to gauge, certain things. But overall, if your symptoms are that of perimenopause, sometimes we will just treat the symptom. Labs don't change our course of action or course of treatment necessarily. So I'm happy to give someone progesterone or estrogen if they need it based on their symptoms and their history without checking their labs. So there's so much conflicting information out there around hormones, when to test, what to test, when to start hormones, do I start hormones? And I really want to start clarifying some of that, but this lady just told me this. And so I'm going to start with that. You can definitely be in perimenopause even when your periods are regular. And we don't necessarily need to test your hormones on blood in order to prescribe hormones. Your symptoms alone can tell us what hormonal imbalances might be going on. And in my next video, I'm actually going to tell you what those symptoms are.